So now let's move to the next topic, manpower selection and training. Since Dr. Satyen DEKA is not there, so I will be speaking on his behalf. Manpower is a backbone for any organization and is one of the most crucial factor in making a high quality eye care service available, affordable and accessible to all. But it requires right people in right number and mix with right resources and processes to ensure effective and sustainable delivery of patient care. The composition of the healthcare team varies based on the population characteristic, the need and the disease burden, but they are roughly classified into three groups: the medical group or the skilled group, the paramedical group or the semi-skilled group, and the administrative group or the unskilled group. The medical group comprises of the ophthalmologist, physician and the anesthetist who examines patients, diagnose and treat diseases. The paramedical group comprises of the optometrist and the refractionist who does the initial evaluation and the refraction. The ophthalmic assistant and nurses who assist doctors and are involved in several type of semi-clinical jobs in the outpatient department. The lab technician who does the laboratory tests, the biochemical and the microbiological tests, and the counselors who help the patient understand the disease better and help them in taking decisions. For the clinical team to be productive, one has to ensure that the there are adequate number of patients attending the hospitals, there are sufficient supplies of resources, and all the equipments are kept in good working condition. So this is the job of the administrative group, which consists of the front desk staff, the medical record technician, housekeeping staff, and stores and supply staff. The need for this manpower planning is to identify if there is any shortage or if there is any surplus of manpower, because that directly has an effect on the labor cost, and we can cut down this cost by avoiding overstuffing. It also helps you to identify the available talents and conduct training programs so that you can develop these talents for the benefit of the establishment. Also, because of the advancement in the medical science and technology, there is always a demand of developing new skills. Last but not the least, it brings stability to your organization. However, for any medical team to be effective, it must possess four major attributes: availability in terms of space and time, competence, which is a combination of technical knowledge, skills and behavior, productivity, which is the maximum, which means that there is a maximum effective health service and health outcomes without reducing waste of while reducing waste of staff time and skill, and responsiveness, which allows them to take decisions which are in the best interest of the patients regardless of their socio-economic status. There are many factors which affects the performance of the healthcare workers. The first and the most important is the recruitment and selection of appropriate candidates. In order to get a pool of suitable candidates, each post should have clear job descriptions and they should be advertised appropriately with enough time for the candidates to respond. The selection procedure should probe not only the candidate's competence but see how he or she is motivated to do the job. Because in reality, technical skills can be developed and improved over time, but it is very challenging for you to change their fundamental belief, behavior and attitudes. Once they are selected, they should undergo an extensive period of orientation, during which time they become familiar with the environment of the organization or the setup, and they engage in various type of group activities, and they network with each other and hear from the other senior members of the organization and get crucial information which may be helpful for them in future. The hospital should also create an enabling environment for its employee to ensure that they have the required amount of resources to work with, and also the understanding and the authority they need to take decision and accomplish their task. By employee empowerment, we mean, and it's a management philosophy actually, which gives the employee the sufficient amount of autonomy, resources and support they need to act independently and be held accountable for the decision they make. They should be given a democratic environment so that they can speak up whenever they find any difficulties while working in the organization. The most sensitive aspect for any employee is the pay and the benefit. The salary is the indicator of how they are valued in the organization. Most often, if not always, dissatisfaction with payment is the main reason for anybody to leave the organization. Another thing that we need to keep in mind is to retain the efficient and the effective employee, because once they become effective and efficient, they have a tendency to move out of the organization and search for better options. In that case, the hospital or the organization should counsel them properly and give them new responsibilities, new challenges which may carry some extra benefits. Also, they should conduct some welfare measures like providing a health insurance to the employee, or some kind of a scholarship for career development, or any form of child care help to the employees. A regular performance assessment and feedback should be there in the organization at least once in a year. During that period, the performance of each and every employee should be assessed and counseled if they are found to be substandard. Career development and training is another point. When you see that the employee shows motivation and ability, they should be given extra responsibilities. This could be an opportunity for them also to learn some new activities and then improve their leadership skills. So to conclude or summarize, the performance of a hospital is the reflection of the quality of people who work there. It is therefore essential to recruit and retain employees with the right attitude, competence, and potential. Thank you so much for the patient hearing.